All right, we will go ahead and get started for today. Welcome to Missouri Open Door Benefit Series for October. Today we will be talking about Medicare open enrollment planning with Missouri SHIP. So these series are sponsored by Medicare Improvements for Patients and Providers Act, also known as MIPA, Priorities 1, 2, and 3, which are Missouri SHIP, the Department of Health and Senior Services on behalf of the AAAs, and UMKC Institute for Human Development as the No Wrong Door designee for the state. My name is Angelina Alpert. I am a research assistant from UMKC Institute for Human Development. So just a little bit of background on Missouri No Wrong Door. The goal is to transform the way people access services in the community by supporting individuals and caregivers to make decisions on complete and accurate information about their options for anyone seeking long-term services and supports regardless of age, income, or disability. So our goal with these series are to enhance integrated supports. So at times, when an individual focuses only on eligibility specific supports, it can unintentionally seclude them from the family and the community that they want to be a part of. So our goal is to have everyone aware of different types of services and supports so that they can integrate them in their lives and be able to live the life that they want. So just really quickly going around the star, those services and supports are personal strengths and assets, which are the skills, things that a person is good at, and the things that they have. Relationships, which is family, friends, acquaintances, neighbors. Eligibility specific is what we get into in this series. Those are going to be needs-based services, whether it's age, geography, income level, or specific diagnosis. We also have community-based, which are places in the community that anybody would have access to. So schools, parks, group memberships, or organizations. And then technology, which is your personal everyday technology, such as your phones, your laptops. And then that also includes assistive or adaptive and environmental technology. And we cover those in our Missouri Open Door Technology series. So just really quickly, we have one more benefit series for the year, and that'll be on November 13th. We are still looking for a topic for that one. And then we've got two more for the technology series, and those will be on October 23rd. It's going to be assistive technology for mental health. And then November 20th, that's shifted a little bit to accommodate for the holidays, and that's going to be on emergency alert devices. And this will be recorded and posted on our YouTube as usual. And you'll also get the slides and recording sent out in a follow-up afterwards. And with that, I will go ahead and pass it over to Ship.
Right. Good afternoon. My name is Gary Gummick, and I'm a member of the Strategic Outreach Team for Missouri SHIP, the State Health Insurance Assistance Program. And also presenting is Ben Franklin. He's also a member of the Strategic Outreach Team, and both of us are volunteer counselors as well. So this presentation is just really intended for beneficiaries and the family and caregivers, and not the media or licensed health insurance professionals. And if you are one of those two groups, go ahead and contact the Missouri Department of Commerce and Insurance for information. So let's just start out with the basics. Who's Missouri SHIP? Missouri SHIP is just kind of a closely guarded secret, it turns out. I know before I volunteered with SHIP, I really didn't know much about them. But again, it's the Missouri State Health Insurance Program, and it consists of trained counselors, about 180 counselors across Missouri, providing free and unbiased education and assistance to Missourians that have Medicare questions. So, and that's a great percentage of the people out there with Medicare, because Medicare is kind of a complicated issue and topic, and so lots of people need help. So we just help them make informed decisions. We don't try to tell them what to do. We just lay out the facts for them. So every state has a SHIP. So CMS has created grants that make it possible to have a SHIP in every state and territories. They started out in 1993, and again, providing Medicare assistance and education. We work hand in glove with CMS to help them with their systems and information that they send out as well. When you get your Medicare and Medicare and Me book or Medicare and You book, on the back of it, you'll see our name and our contact information. So for Missouri anyway, so that's who we are, and you'll see our 1-800 number there. That connects you with our contact center. So if you do have a question, that's the number to call. And the big thing is we don't represent any insurance company. We don't promote any one insurance company either. People that are volunteers for SHIP can't be an insurance agent or an insurance agent even 2 years prior to being a volunteer for Missouri SHIP. So you get unbiased information from us. And so with open enrollment, that's the topic that we're on. That's kind of our Super Bowl. We probably help more people during this upcoming 6-week period than any other period in the year. So we help with enrollment in Part D drug plans and Medicare Advantage plans, just enrollment in Part A or Part B. We give people information on Medicare supplement plans or Medigap. Advantage plans is always a hot topic for people to call in because of all the advertisement that goes on with Medicare Advantage plans. So people want to know what to believe and what not to believe. So we help them with that. If you feel like a Medicare claim was denied and shouldn't have been, we can help you with an appeal as well. So again, lots of reasons to call Missouri SHIP. So for today, we talked a little bit about the general information about Missouri SHIP already. We're going to talk about open enrollment because 'tis the season. So when you can enroll, special enrollment opportunities, what's coming differently for Medicare Advantage out in the 2025 year, the same with Part D drug plans. And we're going to give you a demonstration of some tools that you can use that really just empowers you to go out and make sure that you're getting the best drug plan possible or the best Medicare Advantage plan possible for your circumstances. And then just follow up with how we can help you. So we'll start out with just what is open enrollment or annual enrollment, as some people call it. Runs every year from October 15th through December 7th. And again, for most beneficiaries, this is the time that you have an opportunity to make a change to your health insurance for your Medicare insurance. So it's very important for people to take time during this period to review, make any changes. So any changes will take effect January 1st, but you've got this period through October through the December timeframe, the 15th through the December 7th, to really make those changes. And so we're going to kind of talk about what changes those might be. So unfortunately, over half of beneficiaries don't review or compare their coverage options annually. Some never do. As you see there, 24% never review their policies to see if they've got the right coverage or not. Rarely comes in a close second there, 22%. And the thing is, your health changes every year, and your prescriptions probably change every year. What the company that you have got your Part D insurance with, your drug coverage, they change what they cover every year. So something that may have been covered in a prior year may not be covered in the upcoming year. So that's why you need to kind of pay attention and really review your policies on an annual basis. So what can be done during the open enrollment period? So if you have traditional or original Medicare, as it's called, with Part A and B, you can decide to switch to a Medicare Advantage plan. So you may have been on original Medicare for a while and say, you know, I think it's time I switched to an Advantage plan. I like the sound of dental coverage and vision and some of the other things that they offer, and I think I'm going to give that a try. Well, this is the point in time where you can make that change. You can switch between Medicare Advantage plans, and many people do that every year. And again, that's because most Medicare Advantage plans have built into them prescription drug coverage, as well as the dental vision and that sort of thing. And again, that coverage changes every year. So while somebody may say, you know, this worked out pretty well for me last year, I think I'm going to keep it, without comparing, that can be a dangerous thing to do. So again, check each year on the plans. You can also switch your Medicare Part D prescription drug plan. And again, during this time frame, we probably do more changes to Medicare Part D than any other change the beneficiaries come to us with. So that can save thousands of dollars in itself just by switching plans. Medicare Advantage, if you're on Medicare Advantage and you decide, hey, I'd like to go back to traditional Medicare, you can opt to do that. Now, there is a caution there that if you've been on that Medicare Advantage plan over a year, you may have to go through medical underwriting in order to get a Medigap policy to go along with your traditional Medicare policy. So you may want to check to make sure before you make that switch that you can actually pass medical underwriting to get a Medigap policy before you make that switch. So we can talk more about that later. But those are the main changes. So the one we talked about was basically, Medicare Advantage. They get the benefit of having the ability to make changes during the open enrollment season. Again, that's October 15th through December 7th, as well as January 1st through March 31st. If you've already been enrolled in the Medicare Advantage plan. So that's kind of a benefit for those folks. So again, they can make one change in this January through March 31st timeframe, and the change is going to go into effect the following month. So again, you can change from Advantage to Advantage or Advantage to original Medicare and vice versa. So again, we talked about this being our Super Bowl period and kind of when we do most of or a lot of our business and consultations. But there's also other periods that are called special enrollment periods or SEPs. And in addition to open enrollment, there are certain circumstances where you're able to make a change. Some of these are just if there is a 5-star Medicare Advantage or Part D plan out there, you can switch to that outside of the open enrollment. So I didn't see any 5-star plans out there this year, at least in my area. Again, there may be some across Missouri somewhere, but at least the zip codes that I was checking earlier today, I didn't see any 5-star plans. But we'll talk when Ben comes on. He may have seen some, but we'll verify that. Disruptions in coverage. If your provider said, hey, I'm not going to service this area anymore. If you moved to a different service area, that it's going to disrupt the coverage. A change in eligibility. If you fall into a lower income bracket and you're eligible for some extra help from Social Security subsidies or some of the MSP plans, the Medicare savings plans that help pay for your premiums, you can also get an opportunity to get a special enrollment period. Okay, we talked a little bit about extra help. And again, that's from Social Security. It's a benefit from them that with an income level of a little over $1,900 a year is kind of the income level for to qualify for extra help. And basically that's going to give you help with your drug premiums and knock down the cost of your prescription drugs. But it also does a couple of things. It gives you a special enrollment period. So you see here that you can make a change from January through March, April through June, July through September, and then the open enrollment period to make changes to your coverage. So it gives you more options to make more changes throughout the year. So that's actually a very good thing, and it also gets rid of some of the penalties if you happen to have uh, penalties on your Part D. It eliminates those as well. So that's another benefit. Okay, so what a lot of people are asking is what's changing in 2025? What do I need to be aware of? So let's kind of look at what we know right now. The tough part about the timing for this seminar is everything hasn't been released yet from CMS. So there's a lot of answers we don't have as far as um, costs go. We've got some areas, we've got some estimates, but we really consider them as estimates and nothing else. But so Part A, uh, again, the premium, most people have premium free Part A, and that's for your hospitalization. So most people are paying zero. You know, that's not going to change in 2025. The deductible for each benefit period for hospitalization under Part A this year was $1,632. It hasn't been released yet for 2025. So the rest of these you can kind of read through. I don't need to go blow by blow since we really don't have information yet, but you can kind of see with original Medicare what your deductibles are, kind of what you might pay for hospitalization and skilled nursing. Okay, for Part B this year, Part B is for your doctors. Most people pay $174.70 this year a month. Again, if you're on one of the Medicare savings programs, the state may be picking up that premium for you. If you make more than say $103,000 for a single person or 206 for a married, that amount will be greater than that because they add a little surcharge on there for a high earner. The estimates that I've seen that it's going to go up about $10 to 185 a month. Again, just an estimate. We'll know in a few days what that will actually be, but for right now, that's as good as we have. Part B deductible, $240 a year. Again, we didn't see an estimate out there yet, but typically they keep these things pretty close. I mean, you know, they typically range $10 one way or another. But again, we don't have that information yet. Okay, Advantage plans. So kind of interesting. We were wondering what may happen with Advantage plans, and basically what CMS is telling us is that the average monthly plan premium for Medicare Advantage is actually expected to decrease a little bit by $1.23 in 2025. I will say there are a lot of Medicare Advantage plans out there that are zero premium. So, and there are still zero premium Medicare Advantage plans out there as I looked this year and um, kind of perused the plans for 2025. So there are plans out there that are no cost as well. If you're wondering, you know, maybe you just turned 65 or getting ready and you're kind of doing that, should I go Medicare Advantage or Original Medicare? And you wonder, well, what's the rest of the country doing? Well, it is about split down the middle. Um, Actually, Medicare Advantage is representing about 51% in this coming year. That's what it's projected to be. So again, split right about down the middle, but Advantage is just a little ahead of Original Medicare. And you know, we talked about the zero premium Medicare Advantage plans. 60% of the people enrolling in an Advantage plan will have a $0 premium in 2025. So that's a good thing. There are a lot of benefits packed in those Medicare Advantage plans. Just need to look and make sure that the benefits align with what it is that you're needing in healthcare coverage. Make sure that you can go to the doctors you need to go to and the hospitals and that sort of thing um, as you go. So, and 83% of the people enrolled, if they stay in the same plan, it's going to be the same or lower premium in 2025. So I would consider that all to be good news for consumers and for beneficiaries. So prices are going to decrease a little bit or stay the same. So that's always good. So if you're, again, considering, do I switch from Advantage to Original Medicare with the Medigap plan? Just some things to consider. Original Medicare is an 80-20 proposition. Medicare is going to pay 80% of approved claims. You're on the hook for 20%. So without any supplement or Medigap, that's kind of the lay of the land. So we talked a little bit earlier about timing on switching from an Advantage plan to Original with a Medigap. I would always check to make sure that you can qualify for a Medigap without underwriting if you're going to switch from an Advantage to Original Medicare. Because without that, I mean, the example I always give on the 80-20 is if you go to the doctor, you may have a $100 office visit. Medicare would pay $80, you'd pay $20. Seems reasonable. But if you went in for a heart attack and the bill was $500,000, 20% is 100,000, which breaks most people. And so you need a way to ensure that 20% that coinsurance portion of yours that you're responsible for. And the Medigap does that. So you want to make sure that you're able to get a Medigap before you make that switch. And, you know, don't forget to sign up for a Part D prescription drug plan. And Ben's going to talk about the drug plans and kind of the ins and outs of that. So I won't talk much about the prescription drug plan, but again, review all your medical insurance from the doctors, hospital, drugs, and Medigap at one time. Things to consider if you want to switch from Original to a Medicare Advantage. So one of the nice things about Advantage plans is they have what's called a maximum out of pocket. And that simply means that once you hit that magic number that's listed in your policy, the insurer is going to pay 100% of your claims. So let's say, for instance, that the example I used with the hospitalization and the heart attack, that you were on the hook for $100,000. Let's say the Medicare Advantage plan that you chose had a $5,000 maximum out of pocket. What that means is once you'd pay that $5,000 out of pocket, your company is going to pay the $95,000 that's left. So that's a good thing, and that's done without really, most of the times, an additional premium like you would have in a Medigap. So that's a nice thing that it provides. You know, one of the considerations I tell people, if you're going to consider doing this, the first thing I would check is to make sure I can go to the doctors and hospitals, providers that I want to, because that's the most important thing. It's like I want to go to my doctors. Is there a drug plan, and how does it provide coverage for me? So Ben's going to show you later how to see that, how to enter your drugs and kind of personalize Plan Finder to compare cost among the drug plans. And, you know, the other thing is, can you use the extra benefits in the plan? We talk about with Original Medicare, we say kind of from the neck up, it doesn't do you much good because it doesn't cover vision and dental and hearing aids and that sort of thing. Medicare Advantage does cover those three things to a limited degree. But you need to make sure that you're going to use the benefits in the plan. And so there are some things they throw in there that a lot of people never wind up using, but they switch because it sounded good. And so just make sure you kind of map that out, how you're going to use the extra benefits. And one of the nice things this year is your provider on Medicare Advantage is going to send you a mid-year kind of statement saying, hey, you haven't used this benefit and this benefit and this benefit. kind of to make you aware that you've got benefits out there you haven't used. So I think that's another good thing. Kind of an example of some of those extra benefits: meal delivery, food, produce, transportation, um, dehumidifiers. Some have family counseling, park passes, gym passes, um, home modifications, um, financial literacy classes. So, and these aren't included in every Medicare Advantage plan. I just want to be clear about that. You really have to get into the details of these plans as you're looking at them to see what it is that they provide and kind of what limits are associated with each one of these. Like transportation, you may get 10 um, transportation services. So there's most of these, they all have limits associated with them. Okay, let's just take a break and let's check for our understanding. And if you want to use your chat or Q&A buttons down there, have at it. But so if I choose a Medicare Advantage plan, I'm stuck. I can never switch back to original Medicare. Do we think that's true or false? Well, when I look at this, never is always a dead giveaway on these questions, isn't it? So if you choose a Medicare Advantage plan, you really can switch back to original Medicare. So that's false. B. All right. So I am going to switch over to Ben, and he's going to take you through Part B and Plan Finder and a lot of fun stuff.
Good afternoon, folks. Gary has spent some time talking about some of the changes in A and B, which obviously are pretty minimal right at the moment. And we're going to talk a little very specifically about the Part D, which is the prescription drug plan, or the one that pays for your prescription medications. If you're on the original side of Medicare, meaning you have A, B, and a separate prescription drug plan, then that's what we're basically essentially talking about, is it adds that prescription drug coverage. When we look at prescription drug plans and their availability, we always look at it in terms of zip code. And you'll see some examples, as Gary's alluded to here in a little bit, as we kind of walk through that process. Also, prescription drug plans are sold by private insurers. Many of the names you would recognize in terms of who provides those plans. And also the Advantage plans that Gary talked about there, most of the time, I think is probably a fair statement, will not only include the Part A and B expenses that you have for hospital and doctor, but also will include prescription drugs as part of the Advantage plan coverage. So what do we know about Part D this year in terms of 2025? We do have a little bit more information than we do so far on the changes to A and B. It is anticipated that the average premium will go down just a bit, $1.50 roughly. The deductible we expect to go up, and compared to 2024, but sometimes that's a little bit deceiving because there are a lot of medications, particularly the lower tier or the more common generic type medications, oftentimes are not subject to that deductible. And then when we look at plans for 2025, we need to look at the formularies. Formularies meaning this is the list of prescription medications that your policy covers. There may be some that are not on the formulary list, and that's one of the things that you really want to be aware of when you're comparing plans and making a decision about what plan you might like. At this particular point, it is suggested that there are probably not any significant changes. So if you've had a drug plan previously, the chances are that the formulary list is going to stay fairly constant and not subject to a lot of changes. The last two are a couple of things that are new for 2025, and you may very well have heard discussion of this. Well, if you've listened to any of the news, you've certainly heard some of the political comments referring to this. But next year, in the past, essentially there has been a sort of quote donut hole that was fairly large. And then after you reached roughly in the neighborhood of $8,000, then you went into what is called a catastrophic coverage, where your drugs were covered pretty much at 100%. So this year, the significant change in prescription drug plans is that the total out-of-pocket cost is going to be capped at the $2,000 limit. So once you paid that much, then the plan will pick up whatever the excess is. So that's a real plus with regards to prescription drug plans in 2025. The other change is referred to as the Medicare prescription payment plan. Essentially, what that means is, let's say you have a high dollar drug that may cost you $500 every time you go to the pharmacy and have it filled. So in order to sort of balance that out, what it's going to do is, I think probably better than for lack of a better term, it sort of annualize your cost, allows you to sort of average out those high dollar expenses, so that, let's say you get your prescriptions refilled every 90 days. Then instead of having to pay that high amount every time you refill it, it'll sort of average it out so that it doesn't take a big chunk or a big bite at any specific time. Okay. One of probably the most important thing that you need to remember, what anything that Gary and I are going to say this afternoon, or have already said this afternoon, is called the Annual Notice of Change. And that comes out, and you should already have it. And what that document means is that it's specific for the plan that you currently have. And it goes down any of the benefits in your current plan. If they have changed, it will then tell you on the sort of the left and right-hand side of the page exactly what those changes are and what that's going to mean to you. I strongly encourage you folks, and if you have parents or grandparents, and it's very, very difficult to decide what mail to open and what mail not to open this particular time of the year, because it is coming hot and heavy. But if you see anything that has your company on it in terms of who your insurance provider is, please always open that. And one of those letters is going to be this particular document that really gives you an indication of whether or not you need to be real serious about the annual open enrollment period, so that you do make some comparisons and you do make sure that your policy is the one that's going to best meet your needs in 2025. Okay, Simon. All right. What do I want to think about when I'm considering prescription drug plans? And Gary mentioned this a little bit earlier in some of his comments, but uh, most of us, when we have reached the Medicare age, are often subject to some unexpected changes every year in terms of our health status. And when our health status changes, there's a good possibility that the medications that we take are going to change. So we're going to have some added and some deleted. So it's very important to be able to update that. And we'll see that when we look at the specific example. Also, uh, selecting a pharmacy, and we'll see that in the example also. In other words, the insurance companies establish relationships with the pharmacies. And some of that particular relationship defines how they cover medications. And more specifically, it defines what your copay, in other words, what your out-of-pocket costs are going to amount to. We'll also see in the example the next point, and that is don't focus just on the drug plan premium. There's a lot more to your out-of-pocket cost than that particular premium, and we'll talk more specifically about that. And then the question, does my plan offer mail order pharmacy? Many, many times, mail order pharmacy costs are going to be perhaps the lowest that might be available. Okay. So in terms of exploring your Medicare coverage, what you want to do is to be able to review and compare. And in order to do that, Medicare has a web page. Sonia, are we set up for me to take over and click on?
Yes, sir. I'm going to stop sharing.
This is Medicare's webpage. All you've got to remember is medicare.gov. When you go to this particular page, one of the things that we always suggest is that you set up an account. Now, I cannot do that today because Medicare doesn't allow practice accounts. But there is a way that you can and also search without setting up an account, and that's what we'll be doing. But the importance of setting up an individual account on Medicare's website is that it allows you obviously to log in and out of your account. And anything that you do in terms of comparing plans, it allows you to save that information. And so therefore, it is obviously something that is very helpful from that perspective. So assuming we have set up an account, what we do, let me go back here just a sec. We can go up to health and drug plans and click on find health and drug plans. And essentially what it allows me to do then is begin that particular process. And what this is the process that we go through in order to compare plans. Right now, as of October 1st, all of the 2025 plans are available as well as the 2024 plans for individuals that might need to enroll prior to January 1st. So we put in the zip code. Let's try 64, what was it, 110. Should be a code that's familiar to the folks up around the Kansas City area. Once we click on that, it then asks us what we want to do. Do we want to look at Advantage plans, which you can also compare on this web page? Do you want to look at prescription drug plans, which again, we'll compare, and that's the example we're going to look at this afternoon. For Advantage plans and for drug plans, you can actually enroll on Medicare's website. Medigap policies, you can look at the policies that are available and do some comparisons. But in order to enroll in or to make a change in a Medigap policy, that's something that you would have to do by directly contacting the company or working with the broker, insurance broker that you may or may have purchased a Medigap policy from. Now, let me clarify one thing, and that is when we're talking about the annual open enrollment period, we are only talking about Advantage plans and drug plans. Medigap policies have their own unique enrollment period, which is based on the anniversary of the policy. All right, so once we do that, then we click on Find Plans. And I'm sorry I have to play with this just a little bit, but there we go. Got out of my way. So what do we want to do? We today are going to look at Medicare drug plans. So we click on that. The first thing that it asks us is whether or not we're getting any types of assistance. And Gary alluded to the extra help with drug costs, the Medicare savings plans, which may assist with the Part B premium and some of the co-pays and that type of thing. So we're going to assume for our purposes that we're not eligible for any of those programs. One of the key things to this particular plan is that it does allow us to enter prescription medications. So we would say yes on that and then click next. And we get to this particular screen. And that's the one where I've got to come down here. So what we simply do is type in for example, the medication atenolol. We bring that in that particular manner, click on that. It brings up the different choices in terms of strengths. It allows you to enter the quantity on either a monthly basis, 2, 3 months. So if you get your prescriptions refilled every 90 days, then you could put down 3 months and then go back and change the quantity to 90. And then you simply click on add that to your drug list. So let's look at, we have entered 3 medications. A couple are very common generic medications. If you probably have seen a commercial with regards to the medication Eliquis. Once we've entered the medications that we want to enter, then we simply click on Done, Adding Drugs. And what that does then is brings up pharmacies that are available in that particular zip code, again, based on distance. If you live in a rural area, you can increase that distance in order to perhaps get the one that you want. So let's take the mail order pharmacy. I always like to, when I'm comparing plans, to click on some of the larger pharmacy chains just for comparison purposes. And you can then search for if your particular pharmacy is not available. For example, Walmart is one that doesn't show up. So we can go in and search that way and find that, and it will show us. Why did it not show us? Because it's a little slow loading. Okay. So we add that. So as you notice along the bottom of my screen, basically it's showing the pharmacies that I have selected here. And once I'm done with that, remember I selected when I first started that we wanted to look at prescription drug plans. So what this is going to show me is that I am looking at 2025 plans. The 2024 plans are still available if I needed to look at those. It's telling me that for the zip code, this particular zip code in Jackson, or yeah, in this 64110, that there are 14 different drug plans that are available. It also ranks all of those plans in terms of my estimated total out-of-pocket expense for the 2025 year. So what it shows, for example, this particular plan has a premium of $91.30 per month. It shows that of the retail pharmacies that I've selected, that my total estimated drug cost, including this premium for 12 months, are going to be roughly $1,600 plus. If I chose to get those medications out of a mail order pharmacy, I'm going to save myself somewhere in the neighborhood of 60 plus bucks for the calendar year. And then I can also look more specifically at plan details if I want to. But right now, I'm at a point where I just kind of want to compare some plans and see some of the differences. So I click on that. Again, remember they are ranked from the total out-of-pocket cost for my drugs and my premium. So this is number one in terms of cost. This would be number two, which I can compare. And this would be number three. Then I can click on compare. And when I do that, it basically shows me these plans side by side, indicating a star rating right now for these particular plans. Star rating is a sampling that the Center for Medicare Services takes from beneficiaries in terms of their satisfaction on that policy. It shows me the monthly premium, and you can see this one has the $91 premium, the $20 premium, and the zero premium. So it obviously looks like that this is going to be the best plan. But remember we said earlier, we always want to look at the total out-of-pocket cost, including both the premium and the co-pays that I'm going to have. It also shows the deductibles, if there is one. Now, here's the information I really want. And what this is showing me for the pharmacies that I selected, the total out-of-pocket cost for each of these plans. So as I look through those all the way around, like such, I quickly see that in terms of total out-of-pocket cost for 2025, this plan at this pharmacy estimates that I'll spend a little over $1,600 on those three medications, essentially on the Eliquis, because most of the time, as I indicated, the lower drugs or lower tier drugs is the term we use, typically have very low, if any, copay to them. We also see that if we got those medications by mail order, then it's going to be a little bit less than that. This illustrates the point that I wanted to make, I talked about a little bit earlier, and that is when you're thinking about next year, or even this year, and looking at your current plan to check and see if the pharmacy you're currently using is still the very best pharmacy in terms of your cost. And you can see differences all the way across in terms of what the relationship is between the insurance company and that particular pharmacy chain. Now, the interesting thing is which one had the highest premium? This one. We go back up and look at that. You can see that this policy had a $91 a month premium, which sounds like a big chunk of money. However, when I add the out-of-pocket cost of my medications, it turns out to be the best plan at this particular pharmacy, which simply means that the difference is the copays with this plan at this pharmacy are significantly less than these two plans at any of the same pharmacies. All right. One of the things that I want to share with you right at this particular point, because we're kind of getting to the wrap-up point, is in terms of using this plan, those of you that feel comfortable using computers and like the challenge of learning something new, all you're going to want to know is Medicare.gov. You'll go there, you'll set up your account, you'll work your way through this particular process, and it will be a breeze to you. In terms of calling Missouri SHIP and us being able to help you if this seems to be a very complicated process, that's what we're here for. So we can help you get started if you want to set up your account. We can help you walk through that particular process. If you need some assistance as you get started, we can do the whole process for you. As I share with beneficiaries, if you would like for me to help you and you're comfortable sharing some confidential information, because you do have to have a Medicare number, you do have to know your medications. We have to have your date of birth. So that type of information is necessary in order to set up the account. We may want to pause at this particular point and see if there are any questions. Anybody looking at the screen to know if we've got any questions?
I'm not seeing any, Ben.
Okay. Gary, you want to add or subtract anything? Otherwise, I can take a couple of minutes and go in and look at some of the plan details, or I can switch back to Advantage plans and
Yeah,
look a little bit at that.
I think looking at some of the detail there, it might be interesting just at least on one of the plans so they can see that it kind of ties in with your spreading your costs out, even being able to see what your monthly costs are and how the system kind of breaks that out.
What I did is clicked on the plan details for that first policy and scrolled down by clicking on drug coverage, where it will show in detail, first of all, what my medications are. But this was the pharmacy that had the lowest out-of-pocket costs for the year. And it will show here the yearly drug cost. And you can see where the problem is right here in terms of what's bringing that cost up. So this is an estimate of what the total cost for just the drugs. That excludes the premium. And it also down here will give us an estimate of what our monthly cost is going to be with regards to this particular medication. And obviously at this particular point is when we have hit that $2,000 cap. And That's why it shows, for example, in November and December, there would not be any monthly drug cost. And it compares all the pharmacies. The reason it only shows 3 times here or 4 times is because mail order typically is a 90-day prescription. Where I wanted to get to was down here at Walmart, which shows again the monthly cost for each of the medications. And Eliquis, it shows first the retail cost, and it shows the cost after the deductible, so that the copay kicks in fairly significantly. And that's why we probably saw the total annual cost for that policy at this pharmacy turning out to be the total at the lowest annual cost on that.
Hey, Ben,
Think of anything.
we do
Go
have a
ahead.
question now. So they're asking, is there a penalty for enrolling in a Part D plan years after you become Medicare eligible? What's the penalty for enrolling in Part B post-eligibility?
Part B is in boy or Part D is in dog?
Both.
Both. Okay.
Yes.
Yes, there is a penalty. And in terms of well, let me back up and say it this way. The initial enrollment period for a beneficiary is your birth month plus 3 before and 3 after, 3-1-3. That's your initial enrollment period. And as long as you get enrolled during that particular time frame, you're not going to have a Part B penalty. There's a Part A penalty, but since the premium's 0, any penalty times 0 obviously comes out to 0. In terms of your prescription drug plan, it's essentially 2 months from when you get enrolled in your Part B. So, and if after that particular point, your Part B premium is 10% for every 12 months that you enroll late, and the penalty for the Part D is 1% of the average premium, which is around 30 some odd dollars for every month you enroll late. So if you wait for an extended period of time, and it's not uncommon for us to have to deal with that particular question, beneficiaries will say, why do I want to enroll in a drug plan when I don't have any particular medications that I'm going to take? Well, what we suggest is you go back and you remember that there was one plan that had a 0 premium. So for all practical purposes, you can enroll in a drug plan that does not have a premium, which would help you avoid the penalty and also minimize your cost for prescription meds. Gary, you want to add anything to that?
No, I think you covered it well. And we're probably at time where we need to go back to our last slide and make sure we show the survey question, or they ask for the survey and the QR code. So maybe if you'd stop sharing and Sonia can bring that up.
Okay, we've covered those. So we'll just go on through those in terms of the key points. That's what we've been talking about. Go ahead, Gary. I'll go ahead and finish that then.
Yeah, go ahead.
One of the things that Missouri SHIP is always looking for, those individuals that would be interested in helping other individuals like Gary and I do in a volunteer status with Missouri SHIP. I would strongly encourage you to explore that. If you go to MissouriShip.org, there's a page there about volunteering and some information. Or you can call that 800 number. That's the number if you have any question about Medicare. as well as volunteering. That's our 800 number you can call to get that type of assistance. Case. We don't have any other questions at this point. Okay. So we appreciate your participation today. Hope that it has certainly been beneficial. Hope you have felt comfortable calling us so that we can help you at any particular point in time. And you can help us also by scanning that QR code or going to that particular website and providing us some feedback. Your feedback is valuable to us because we need to know what you need. So please let us know. Angelina, we'll turn it back to you, I guess.
Okay, thank you, Ben and Gary, for presenting today, and thank you, Sonia, for your help. And thank you all for being here. We'll hang out just for another second if anybody has any other questions that they want to toss in the Q&A. Otherwise, thank you all for being here, and we will see you next time.